Hi, everyone, and welcome to the show. We decided that we wanted to do something a little bit special since we are in the midst of the holidays. We wanted to offer patients who have peripheral artery disease, which is, we always talk about, it's the blocked arteries and mainly the legs that can restrict blood flow to the feet. And a lot of them have had some great care this year. And so they wanted the opportunity to thank their care team. We're going to give them an opportunity during this next hour to thank their care team, share some of their stories. And we're also, I think, if we have time, we're going to take a look forward into 2024 and what we look forward to most, maybe some of our goals, maybe what we hope for in terms of improvements in care for peripheral artery disease patients, not only in the US, but maybe around the world. We'll see where this goes. But John, I think that you're willing to give up the reins for this moment of inspiration, which
Listen,
you're going to
but before we do the
give to
moment of
me.
inspiration from Miss Kim, I do want to say, because I think this show is about patients. The Save My Piggies is about patients. What you do is
Yep.
about patients, and we now have a show for patients. So I'm really excited to hear what folks are thankful for. But I will say that I'm thankful for the work you do, Kim, and the countless hours behind the scenes of putting this stuff together. And when you talk about what I want to see in 2024 is I would like to get more involved with kind of helping you because you do so much work and I just kind of show up and I help out at some to a lesser degree. So my goal is to be more helpful to you, but I do want to thank you for what you do because
Oh.
there are countless patients that you've helped. Obviously, you're not a physician, you don't do the work, but you get the patient where they need to be. You are kind of a middle person that helps facilitate good care, and so don't ever lose sight of that. Keep on fighting. In 2024, we're going to keep fighting, and we're going to save a lot more piggies. So thank you for what you do.
Yeah, and I'm really thankful for, Cardiovascular Systems Incorporated's Jim Wilson and his team. They're now uh, Abbott, and Abbott has continued. We're so appreciative of them continuing to sponsor the show. But it was really initially CSI that came in and introduced the two of us. And I was so impressed with your passion and commitment to sharing the patient story and raising their voices that I'm so glad that you trusted me and that we were able to collaborate and expand not only the Save My Piggies, but our entire show to be on the radio, which is now the heart of innovation.
Well, yeah,
So,
it's amazing, and we have no shame, right? So we do need sponsors. We have to work to get sponsors to
yes.
help drive this engine and this vehicle forward. We talked about last week. We want to have a Save My Piggies kind of maybe well, what did you say? International, national kind of
Yep.
virtual event, hopefully in 2024. So we've got a lot of big plans. But before we talk about that, we have to have our moment of inspiration. And we have I have allowed you, Miss Kimberly, to provide us with a wonderful quote from, I think, a mentor of yours to some degree, right?
Yes. Sir Richard Branson. I ran the Extreme Tech Challenge, which I grew into the world's largest startup competition of its time. And it's still going on. It's run by some other folks now. I think it was Samsung bought it. They're working with some other teams, but I was glad to be a founding executive director and work with Sir Richard Branson, who was our anchor judge. And one thing he said to me that always just has stuck with me. He says, just say yes and figure out how to get it done. And I think that that rings true with this particular show overall with Save My Piggies in the Heart of Innovation. But this particular episode, it was, you know what? Just say yes and figure out how to get it done. I have no idea where we're going with this show. We're going to let the patients take it and run with it and just raise their voices. So just say yes and figure out how to get it done.
And
Let it flow.
I love that because there are a lot of people that say no, and saying no is pretty easy because if you say no, it ends right there. Like
Yeah.
that conversation ends, that initiative ends, whatever it is that you're doing ends. If you say yes, well, now you got to do something about it. And you may not be able to get it done, but at least you're going to try. And I think that's a fantastic quote. And a lot of our patients and a lot of the people that you've helped, that I've helped this year, keep saying yes to preservation of their limb, their toes,
Yes.
their life. because as soon as that patient kind of throws the towel in, then family members, you can't really help them then. And then the docs say, well, I always say patients, I'm going to help you and I will fight for you as long as you want to fight for yourself. Because I've had patients say, you know what, I've had enough, so much pain, get rid of the toe, get rid of the foot. And you hate to have that it becomes defeatist to some point, but they're suffering. But as long as someone's going to fight for that foot, their life, their limb, I'm gonna fight for them, and I know you will too.
Exactly. And I want to thank all of who we call the PAD warriors, because that's what they are. They're truly warriors. Peripheral artery disease, and especially its advanced stage critical limb ischemia or critical limb threatening ischemia, is one of the most debilitating diseases that most have never heard of, yet impacts 1 in 5 people over the age of 60, 1 in 3 diabetics over the age of 50. And it's not easy. I mean, so many people end up not being able to walk, and walking is the best medicine for it. And once you get to the point where they have rest pain at night, they have wounds that develop, I mean, it's a real process, and the pain is excruciating. And so I can imagine we've had quite a few people that have said, you know what, I can't take it anymore. Legendary Harlem Globetrotter Larry Shorty Coleman, who's been on this show quite a number of times, said, you know what, I got to the hospital this one day and I just told the doctor, I can't deal with it anymore. I can't imagine that even any procedure at this point is going to get rid of this pain. I just can't fathom it. And so he's like, just take it. Why delay the inevitable? And I think it's one thing for a patient to say that, but another thing for a doctor. I don't like it when a doctor says to one of our patients, hey, you're going to lose your leg at some point anyway, so why delay the inevitable? That really bothers me.
Well, I'll just say this. I saw a gentleman who a year ago, well, so okay, it's September of 2022, and the beauty of this story is this guy at the time was 85 years old. He had multiple interventions to his lower extremities. He had coronary disease. He was seen by his interventional radiologist, who, great guy, but said, I'm in over my head a little bit with respect to his PAD. Can you help me? And so we did an angiogram. We kind of looked at it and said, wow, you got a lot of blockages, sir. I'm not sure at present, we didn't need to do anything because he was just having pain when he walked. He didn't have any critical limb ischemia. Actually, after the procedure, he started having chest pain. So then I had to do a heart catheterization on him, and we had to fix the blocked artery in his heart. And then he developed blockages or more blockages in his legs. And we couldn't save the left leg. So he ended up needing an amputation. He got a below the knee amputation at the age of 85 years old. Now, that's sometimes a death sentence for someone who's 65. But he said to me, he's like, you know what, doc, I'm going to get a prosthesis and I'm going to walk. And I'll be honest with you, in my head, I said, BS. Like, there's no way there's no way, dude. So anyway, he gets the amputation. Well, then he develops blockage on the other side, and I opened the other side up for him. Fast forward to, I saw him last week. He had his amputation. He has now the stump is healed. He has a prosthesis, okay, that he is walking on at 86 years old. Wow. And the leg we worked on, he lost a toe, but that is everything's still kind of intact there. So you got a guy who's 86 years old. If he can do this at 86, 85, get a major amputation, get a prosthesis, anybody can do this. And so that I wanted to bring that up because it was so motivating to me that you just scratch your head like this guy is unstoppable.
And that's why, even if we develop, we've been talking a lot in the industry about creating more specific standards. Standards are one thing. We need to, beef up these standards, make them more specific. But there still has to be room for the conversation with the patient. That the supervising physician has to be able to, have the conversation and provide that unique treatment for that unique presentation of disease and that unique personality, right? And I think that that's really important. There still needs to be that opening for the conversation with the patient.
Well, right, because at the end of the day, like we've talked about before, you're kind of a coach. I'm a coach. The patient is the player, the quarterback, whatever. They've got to execute the play. We can help them along. You do it your way, I do it my way, but they have to be on board. The we did we did a show earlier about how do you ask your doctor the appropriate questions regarding a potential procedure, and a lot of times physicians don't necessarily like to be questioned about, well, how many of these have you done? What are your outcomes? What do you use? What do you don't use?
Yeah,
And a lot of the questions are appropriate, some maybe not so much, but you need to find a physician that's willing to be open and say, you know what, maybe I'm not the right person for this, but I can get you to so and so who can, or I do a lot of these and we'll take good care of you type deal. So the patient absolutely has to be involved.
I agree. Well, coming up right here on the Heart of Innovation, we have our live studio audience that is waiting to share their experiences and their thank yous to their care teams. So we're going to get right to that in a moment. Stay with us right here on the Heart of Innovation.
Welcome back, everybody. Today is, well, it's going to be, I think, our final show of the year, or pretty dang close to it. But in doing that, we wanted to say thank you to each other and thank you to our patients. And our patients wanted to say thank you to their doctors. And we've got several folks on the line. We're going to start with Alan. Alan, thanks for joining us. You've had an amputation. Is that correct?
Yes,
And
sir.
but you're still
Yep.
thankful for your physicians who have been helping you out, right?
Well, Doc, I wouldn't have any legs right now if it wasn't for you guys. I still got 7/8 of a right leg left. I've also got no toes, but I'm getting around on a walker. I was just cleared for a prosthetic. I saw my vascular care of me for the last 15 years, with Kym's help, Dr. Mustapha, Dr. Saab, Dr. Madassery, and fantastic podiatrist, and a fantastic orthopedic surgeon. I just recently broke the stump, and it's healed, and I'm ready for a prosthetic. But all these docs played an integral role in getting me to where I am now. And without them, I, again, wouldn't have any legs. I found Kym at just barely the right time, where my critical ischemia had gone so far south and became such a difficult case that doctors, they really didn't want to touch me. And even at the bigger university hospitals, they just shook their heads. And so I had some docs that took me on and turned it around. And my Dr. Newman and Tattersall locally have taken care of me again for 15 years. And Dr. Newman got to see her on her last day before she retired. And she gave me a fist bump and a hug. And we got to where she wanted to see me. And I'm just grateful to all of you guys. And as you, John, have probably said to yourself before, why do I get into this? Always tell your doctors thank you. Always. Because it gives them a little bit more insight and courage to keep going, because it is a thankless job at times.
I appreciate that. And, I will say that in years past, people will say thank you to me for doing things. And it's kind of like, yeah, it's part of my job. But lately, I don't know if I'm getting older and more, just reflecting on things. But I do think about when someone says thank you to me, and I always say you're welcome, because as we've talked about, you patients who have this disease process, it is a process, and it doesn't end. It is like cancer. You have to kind of beat it back, and you have to have positive attitude. And I appreciate when patients say thank you, and I always do my best to say you're welcome.
Yeah, it's so important. It's hard because I don't know about you, but I do it because I love what I do. I don't do it for the thanks. I don't do it for any other reason, but because I just have a passion for helping people. And Alan, we've been there. I mean, I feel like I've been there from the beginning with you. We've cried, and I just thank you for the trust that not only you have had in me, but also your wife, Katie. That conversation that we had when you were in the hospital room, and you were deciding whether or not to have this amputation, to have that trust and that faith and that vulnerability that you had to allow me to be a part of that conversation where you were saying, I don't want to be a burden to my wife. I don't want to be a burden to my family. I shouldn't have the amputation. I would rather die. And you're gonna make me cry.
Sorry
Because
about that.
It was really such an emotional. And then I got on the phone with your wife and I said, how do you feel? And having you together, and she's like, he's not a burden. I would rather have him in a wheelchair with no legs than not having him at all. I didn't fall in love with him because of his legs, right? I fell in love with him because of who he is. And you were just like, really, Katie, are you sure? And she said, yes. And you said, okay, I'm going through with this. I will keep fighting. It was the most powerful moment that I just feel honored that you shared with me.
Since then you become like a little sister. You're one of my best friends. And
I just adore you.
It was a real hard decision to make. I'm going to walk again here in the next few months.
Yes, you are.
I'm very determined. It won't stop.
John,
if I'm ever in the Columbus area, because I travel the Ohio area a lot, and I have a problem, you better be there. So I'll have somebody give you a call.
All right. Yeah.
I got a network.
I'd love to see you. I'd love to see you.
And Alan, what was that catalyst for you? Was it the amputation? Because you really took life by the reins at that point, and you got your A1C down. I mean,
It was 13.7 in the hospital up there. I've got it at 6. So I'm doing well. My creatine's better. I've had several setbacks, osteomyelitis. They revamped it again, and I fell and broke the stump in September. And I was, I get to that point, and then it's huge. You feel a huge letdown. But then you just get back up, and I think a big part of that was Katie. I mean, that and 5 grandchildren. It was just, I think the thing with the being a burden was my father had a stroke when I was 13 years old. So I was taking care of him, and I think that's where I got that mentality from, is I want everybody else's life to continue just because mine has slowed down. And, but after her saying that in the hospital and hearing it, that gave me the fortitude to go forward.
Yeah. And
Well
it's
done.
interesting because before you met me, you were already on deck. They had already talked about amputation, and what we said was, well, for both, right? And so
right.
we said, if you're already on deck for amputation, then are you open to at least trying, at least, walking to live another day, just seeing if it'll work?
Yes, I was searching. And if it wasn't for the search on Facebook, just for a support group, we would never met.
Nope. And you went to
so I'm grateful.
You went to Dr. Mustapha, you went to Dr. Saab, and they at least tried. But what you probably are really thankful for, even with them, is that you trusted them to at least try, and you trusted them to know when to say when, and they knew when to say when, and they helped you make that transition back over to Dr. Madassery over in Chicago. And he worked with the vascular surgery team.
Right. They both worked on me for a total. I was in working within a week and a half of time. I had developed gangrene on my toes, on my right foot. And they worked on me. Dr. Saab and Mustapha totally worked on me for about 13 hours. Everything from my hip all the way down to my foot, and both legs was completely blocked. So they opened everything up that they could. Then I went to our local hospital, talked to a doctor about amputation of the foot. Then I said, you know what? Let's go get revascularized first before the amputation of the foot.
Right.
That was in
And
October
that's
of
why.
last year. And then I jumped in February of 2023 is where I had the amputation of the right leg.
Yeah. But it's good.
With Dr.
The good
Madassery
part
again.
was they opened up as much as they could to the
Yep.
point where they could minimize, the amount of amputation that was necessary. And that became the goal, because Society for Vascular Surgery and American Heart Association guidelines suggest an attempt should be made to restore inline flow prior to any amputation. And that's really what they were doing, was just trying to minimize it. And I really appreciate your bravery through the entire process, your courage. And I'm so excited in 2024 to see you back on your foot and your prosthetic foot and getting out and taking more steps to better health, right?
Yes, ma'am.
Thank you so much, Alan. We really appreciate you. You're amazing. Thank you also for being vulnerable. And I think that your story will inspire others. And coming up right here on the Heart of Innovation, we'll hear the amazing, inspiring stories from some other PAD warriors. You don't want to miss it, so stay with us.
Welcome back, everybody. Today is a show about thank yous. Kym said earlier, we don't ask for thank yous. We do it because we love to treat patients and help patients. It's nice to get a thank you. We appreciate them, but we don't need them. However, we've got plenty of guests, patient guests, who want to thank their physicians. And Nancy, you have a special thank you for your physician. Is that right, in 2023?
Yes, I do. And first of all, I would like to thank him. Thank God I found this group. I'll never forget the day I learned about them, because I was so ignorant of everything and terrified. And I want to thank you too, also, Dr. Phillips, because you always are smiling and you put me at ease. I get nervous doing this. Yeah, I want to thank Dr. James Antezana, who Kym recommended to me. By the time I got to him, I had a carotid artery blockage. He ordered a CT scan, and I also had blockages in my legs. But we wanted to get that done first. By the time he ordered that CT scan, I was like over 90% blocked. So he looked at it and said, I don't feel comfortable with this. I want to send you to a neurosurgeon in Charlotte who trained me, and he's top notch. And so basically, I feel that by the time they got me in there, I was almost 100% blocked. They did T-core surgery, and I'm fine. The risk was low. I think it was like a 1 to 3% risk. It was very low risk, and risky way to do it. And from there, I went back to Dr. Antezana. He did an angiogram in September, put a stent in my left leg, my left thigh. I am now walking 8,000 to 10,000 steps a day. Going to start taking yoga, little weightlifting. I feel great. I have no pain in either leg. I do have a blockage in my right leg. We're going to be looking at that next, but I have no pain. And I just want to thank Dr. Antezana. He's been fantastic. And I'm got my A1C down. I'm pre-diabetic numbers right now. I'm doing everything I can. I have a lot to be thankful for this year. My 4 grandchildren are so happy, that I'm doing so well. So I want to thank everybody, and Kym is fantastic. She's been there for me with my crazy questions and every step of the way. So I really appreciate it.
I love the fact that you're such an advocate for yourself as well. It's been a pleasure. And, we've talked about it before. If you're not having pain, I guarantee you that it's good to keep an eye on that blockage. Good to know it's there. But if you're walking 8,000 to 10,000 steps a day, keep walking 8,000 to 10,000 steps a day. And it doesn't matter whether the blockage is there or not. It shows that your body, if you're pain-free, your body is likely building its own natural bypass with every step you take. So you may never, ever even need a procedure. Walking is truly the best medicine.
Yes. Well, I'm going to go back to see Dr. Antezana, and he's going to start monitoring me every month. And we do Zoom calls, and he is 4 hours away, but I have an appointment in May, and we'll go from there. But I'm going to keep working as hard as I can, and of course, be very involved with this group. As you know, I'm handing out brochures, and it's amazing to me how many people aren't aware of this group? They're not aware of the help out there. Every doctor, every PA, endocrinologist PA, cardiologist PA, they love the brochures. They love the group. They love what you're doing. So we got to keep getting that word out, you know.
I'll send you some more.
That
It
means
was
some
great.
more.
She asked me to send her these brochures. And whose office did you brought them to your primary care office, I think?
Primary care, my cardiologist PA, my endocrinologist PA, some of the radiologists that, or the ultrasound people that I'm going to, they're just, everybody's so excited about these brochures and saying, I've got so many patients with PAD. And they don't even know about your group. And so I'm glad to get the word out, you know, and I'm going to keep pushing that, getting that word out to everybody. So it's helped me so much, Kym. So.
Thank you. And actually, it's interesting, and what a good transition, because Charles Winters out of Texas is also handing out these brochures. And we might have to do the same that we did for Charles for you, Nancy, with Charles. Hi, Charles.
Hey, everybody.
Charles.
Charles, he shared his story. He wanted to put his picture and his story on the front of the brochure. So instead of our iconic PADDY, Patty, our little heart person, we ended up putting Charles on there with his family and a personal letter to anyone who reads the brochure. And then on the inside, of course, it talks about PAD and what it is and treatment options, etc.
Okay.
But
I'm game.
So maybe we do the same for you.
That sounds good. I'll put a couple of grandchildren next to me. That I have a granddaughter who expects me to live to be 90. So yes, she's very happy that I'm getting through all this. Or great support. My family's been fantastic. But yeah,
I love it. Well, we look forward to in 2024 for you to continue taking those steps to better health. And I want to see a record 15,000 steps one day.
I got 14,000 the other day. So.
Oh, fantastic. So you're almost there.
Dang, that's awesome.
And no pain, best part. So
that is the best part. And John, I mean, seriously, that's music to any vascular specialist ears, isn't it? Especially with PAD.
Yeah, you know, honestly, I was just reading this structured exercise program, you know, with a 6-minute walk. If you do it in a hospital or like a cardiac rehab facility, you probably maybe get another 40 meters of walking distance. You do it at home, you get about 50 in that 6-minute walk. So the more walking you do, there is definite benefit to walking. Not everybody can walk or can walk as much as we tell them to walk, but walking is that's the elixir of life. Exercise is the elixir of life.
Yes. And yeah, I'm addicted to it now. And it also is good for my head. Mentally, it's good for me to get outside, fresh air, and makes me optimistic. So I'm addicted to it. I walk every day.
Definitely. Thank you so much, Nancy.
As I tell my son, there's 2 types of pain in life: the pain of discipline and the pain of regret. And the pain of regret is more powerful than the pain of discipline. So when you guys don't feel like doing something, think about that. Be disciplined. Don't get that pain of regret. Keep focused, keep working hard, keep walking.
Yeah.
That goes for us too, Kym.
I know, me too. You know, it's so funny because my dad always asks me, he's like, are you on the elliptical today? Are you taking the dogs for a walk? I'm like, I'm sitting here helping people. He says, well, do it on the go. Just go.
Exactly.
Take 15 minutes every hour, get up and move.
Yep, exactly.
Yeah.
So, well, thank you so much, Nancy. And I want to welcome back in Charles. Charles, thank you so much. Our new director of the Diversity, Equity, and Inclusion Committee for our nonprofit, The Way to My Heart. Thank you so much for agreeing to take on this role in 2024.
Thank you.
And who are your thank yous for?
Of course, I want to thank God first for just life and being here. Also want to thank Dr. Phillips and Kym for this platform. I really think it's good work. We just got to keep on getting the word out about it. I want to thank my personal advocate, my wife, that just doesn't take no for an answer when it comes to anything dealing with me. I also want to thank my cardiologist here in Louisiana that first diagnosed me with PAD and did several interventions to help me. Also want to thank Baylor in Dallas, Texas for my kidney transplant. And most of all, I want to thank Dr. Siah that saved my leg. After several failed interventions and even a bypass that got infected, he said yes to trying to help me save my leg. And I'm thankful for him for doing that. And he did. And, you know, with being a new kidney transplant patient and having an infection in a bypass that was just taken out, he said yes. And he got the job done. And he told me and my wife, and I'll never forget, that we're married now and we're not getting a divorce. And he's just been awesome. I just love him, his bedside manner. And it's not, you know, patient number 6 in room 5. It's Charles and Pam. And I love that about him. So yeah.
Coming up right here on the Heart of Innovation, we're going to hear more of your story and your thank yous. So stay with us.
Welcome back, everybody. We're continuing our show about thank yous. And Charles, you were thankful for a lot of things, particularly your local physician there, Dr. Siah. But Charles, I have a question for you because I was thinking about this today. Last night, I read an article about PAD and the disparity of PAD between ethnicity and gender and things of that nature. So I was thinking to myself, you know, how can I give back to my community? And I want to figure out how to get involved in the African American population, because people with African Americans have twice the likelihood of PAD than those of their, you know, white counterparts. But I don't see a lot of African American patients. So I'm going to ask you, because I know you're now the chair, or, you know, you've got a big title here for diversity, but I'm going to put you on the spot. What can you say to a guy like me who wants to get involved in his community and really reach out to African Americans and those that are not appropriately represented to help prevent peripheral arterial disease?
Coming from my perspective as a kidney patient, I didn't even know that I was at risk. So I would start with dialysis centers because, especially in my area, a lot of the people you see are African Americans, and then a lot of people that you see there have an amputation. And I think if we started some kind of program to start early checks for PAD, I think it would help in our community. Working with another group that brings a bus that has ABI capabilities and things like that, and they go to marginalized communities. I think if we could get those kind of programs in a larger scale across the poverty-stricken areas, I think we could get the word out, and we can stop amputating so much.
Kym?
And what about, you know, just in terms of you know, your culture, do you have a message to other African Americans to not just settle for amputation, to get that second opinion? Just because someone has a title and a white coat doesn't mean that they have the only option for you.
Well, you said it, that just because it comes from a white coat doesn't mean that that's the absolute end of it. And I'm a living witness of it. I was a night's sleep away from having my leg amputated. I mean, the OR was booked and everything. And Pam just was like, no, this ain't it. And so reaching out to you and Dr. Eves, and we found Dr. Siah, and he said yes. So a second opinion, a third opinion. And I will say this, even if the doctor doesn't particularly like you asking for a second opinion, because the doctor that did the bypass, he wasn't excited about us asking for a second opinion. And he even ignored a couple of calls from Dr. Siah. So, but keep pushing for that second opinion or third opinion. I mean, amputations are final. So, yeah.
Ooh,
It's
I like
interesting that you said, because Dr. David Alper, who is a renowned, actually now retired podiatrist, he put a video actually on YouTube, and it talks about the importance of getting a second opinion. And he said, any great doctor will be totally fine with you getting a second opinion. And in fact, it is a red flag if a physician says, don't get a second opinion, or scowls at the idea of that, because there are plenty of patients to go around. And if you really care about what you do and you care about that patient, then you would be understanding of that patient's request to want to understand all of their options available. They trust you. It has nothing to do with that, but it is an understanding of knowing that, hey, there might be a different option elsewhere. And I think any great doctor understands that.
Yes.
So thank you so much, Charles, for being here. And in fact, Dr. Phillips, we are going to have a Save My Piggies African American Experience the third Saturday in February. And Charles is going to spearhead helping us to set up the agenda for that particular conference. So I'm really excited about that. And again, thank you so much, Charles. We really appreciate
Thank you, Kym. Thank you, Dr. Phillips.
Yeah, Kym.
And we
I
also
think
have with us
Oh no,
Marcia.
sorry. Yeah, just real quick. I mean, what you've done here, the ability just to kind of get people in a forum where they're comfortable sharing their stories, they're vulnerable. I saw some tears a little bit there from this one. So again, I hate to harp on it, but I don't hate to harp on it. This is a fantastic venue for patients, and again, we got to keep working. So for 2024, because we're running out of time, 2024, we got to get some sponsors. So if you're listening out there, industry people, help us out.
Yeah, it's really important because we want to continue to raise the voices. I mean, I feel so blessed to have some of the most amazing humans on this planet as part of our network. Charles and Nancy and Marcia and Alan and Carol and Kym and everyone in our studio audience, and Douglas and Dee, who spoke in last week's show. I mean, you mean the world to all of us, and we appreciate you. And on that note, we want to bring in Marcia. Marcia is here with us in our live studio audience, I think every single week, helping to inspire us and contribute, sharing her insight, asking lots of questions. Marcia, who are you thankful for? We're thankful for you.
Well, thank you. Well, as Charles said, I'm thankful for God, number one. I'm thankful that my brand new primary care doctor knew right off the bat that I had PAD. So, I mean, without that, I wouldn't have, it would have delayed things. And then right after that, I went searching and I found you, and you have been a godsend. So thank you. You and Dr. Phillips, both of you, for what you do. But I know you put in the hours with us, without a doctor's salary. So I really do appreciate everything that you've done. You've gone to my appointments with me. You've been in the operating room with me, or the cath lab with me. So I'm very thankful, and I'm thankful for Dr. Coral down at Christ Hospital. He's been, and his whole staff. They're just amazing. I know after my first intervention, when I went for my follow-up, I took them all little bundt cakes, and I thought, this is probably so wrong to bring these into a cardiologist's office, but I figure they're the healthy ones, not me. So,
oh no, they're not. I can't tell you how many times there is pizza waiting outside the cath lab door. I've been in many offices with that.
They loved them, and it was just a way I could say thank you, and maybe they would remember that they were appreciated, but maybe also remember me the next time I called. And so I'm thankful for them. And I'm thankful for a good vascular surgeon who said I didn't need vascular surgery. because probably a lot of doctors would have just gone ahead and done it. As I listened to everybody say who they were thankful for, my family's all gone now, they're deceased. But, you know, they've played such a big role in this. And they're not even here because I grew up with a handicapped brother. And they kind of taught us, I had another sibling, there were 3 of us total, but they taught my sister and I kind of not to feel sorry for ourselves and get up and go and do what you can do and how lucky we were. And I think I've unconsciously relied on that to, you know, you have to get out and walk, you know, don't sit around and feel sorry for yourself. And, you know, you can't have those potato chips, even though you want them, you know, you need to, it's just been a motivator. And so my family, who aren't even here, have instilled probably a lot in me that I didn't even realize. Grit. And I'm thankful for that. And I'm thankful today I've already done over 12,000 steps. And with hardly any pain. And it's an education, because some days I struggle to get 5, but when I get in the habit of going, they're easier to come by. So, and I'm thankful for this group. So many of the other people, BJ, I don't know if she ever watches this, but she's a goer and a doer and a hiker. And I hate the cold, but because of her, I'm pushing myself. And it hasn't been too cold here yet, but colder than I like it. You know, I'm pushing myself to get out there in the wintertime and to not let it be an excuse. So there's a lot of motivation in this group. So I'm thankful for a lot.
Thank you so much, Marcia. And coming up right here on the Heart of Innovation, we have 1 more, maybe 2 more stories and thank yous. So stay with us. You don't want to miss out.
Welcome back, everybody. We are rounding third for our show of thank yous. And who better to finish the show with than Douglas, our stalwart, and the guy who's all like Marcia, always on the show, rain or shine, ordering French fries or not ordering French fries while we're live.
His credit, they weren't for him.
Right, exactly. Sure, yeah, sure.
Douglas, you missed the show where he had the potato chips when we were having a healthy cooking show.
Oh, that's right. No, I was on. Wasn't I on for that one?
Anyway, I think you've left by that point.
Oh, did I leave by that point? Okay. Well, we only got 3 minutes left. So, Douglas, who are you thankful for?
Well, first I want to say, Mr. Phillips, Dr. Phillips, we really do appreciate you, because being a father and all you go through, being the doctor and soccer and all the stuff that you go through, to take time out and be with us and share with us, it really is very much appreciated. And the second, I would like first and foremost to thank everybody in this group. Everybody, every single one of you is an inspiration of hope, courage, and strength with every step that you take. Alan keeps me going. Marcia keeps me going every time I stop at the grocery store, making sure I don't want to have to listen to her complain about my chips. And so everyone in this group that gets out every day and walks, that's what this group is about, is each and every one of us supporting each other, being there for each other, and the inspiration, hope, and courage that we all bring to each other, you know. And I think everybody said it pretty much, generally speaking, is the number one person that we probably all are grateful for. It's a blonde lady, some blonde lady from California who's got a new hairdo. And I think we have to thank God for that one moment that he put in her heart to create this for us. That is just simply that one most amazing thing is that, and I know a lot that goes on behind the scenes and what she goes through 24 hours a day on the phone, spending her own money. Like Dr. Phillips, you're right. We got to find some money to help out. And her life revolves around each and every single one of us in this group. And we we can't say, there's no, thank you is just really inappropriate sometimes, but it is a thank you for Kym and what God has placed on her heart for us and what she goes through. It's amazing. But it's all of us together. It takes, there's no I in this team. It's all of us. The inspiration. I get up every day and walk because Alan and I talk a lot sometimes, and I see what he's been through. And Alan, you give me the inspiration to get up and do what I do also. So,
hey, buddy, I hop.
That's right.
You hop.
So, and Charles, I'm here. I got your back, bud. Whatever you need, we got you. All right. So, but the number one thing is for 2024 is very simple. One extra step, no matter what, for all of us, that one extra step. With what I've been through and what I have come to, the conclusion is my legs and my body is where it is right now because I have not given up. And I haven't done that through all of y'all that have given me the inspiration, the hope, and the courage and the strength to keep moving. So it's all of us together. We'll make this work in 2024. We need to stay in our lane. Some people know what I'm saying. We need to stay in our lane and focus on what we do, because that's why we're here. Let everybody else do what they do. Let them do it the way they do. But we created what we have now to go further with. And 2020, by the end of next December, we're going to be trying to figure out how to keep everything together because it's going to be overboard. The boat's going to be overflowing. And we got to believe and trust in that process. And that one extra step, no matter where you are. If it's to the end of the hallway, I don't care. If it's to the other, watch. 3
Just
steps.
to the other end of the room. Yep. Thank you so much, Douglas.
That's 6 steps that I had not had taken before. And even though it's just 6 steps, it counts.
Yeah.
Like he said, mentally and physically. So
thank you, Douglas. And we're so appreciative of you and your inspiration every day. You're here every single week. In the Live Studio audience, you inspire everyone every day with every step that you take as well to improve your health. So thank you so much for all you do for everyone. And John, of course, I'm so thankful for you. 2020, cheers to 2024.
If I had a glass of wine, or here's some old coffee. Cheers.
Mine too.
Thanks, Kym. Thank you so much. Thanks for being the ultimate patient advocate.